Welcome to our lecture on strategic planning in pharmacy operations. This lecture is going to be part of the second of our types of planning. We talked about operational planning in our prior lecture. And this lecture, strategic planning, is more planning for long-term projects or planning in adding a new service to the business. And so we're going to focus on what are those aspects a pharmacy leader, a pharmacy manager needs. A lot of this material that I'll be discussing can be supplemented by reading Chapter 4, Strategic Planning and Pharmacy Operations in the Pharmacy Management Essentials for All Practice Settings. So let's begin. The learning objectives for this lecture is we're going to describe the process common to all types of planning. We're going to describe the purpose of strategic planning and the specific steps to develop a strategic plan. And we're going to identify the purpose of a strategic plan and highlight examples in a pharmacy organization. In addition to this video, there's going to be two more videos I would like you to watch that goes along with this lesson. And that is, I am going to review the reflective exercises due this week. And then I'm also going to review the final project. Well, it'll be the final project for the first focus one of community pharmacy management. And the reason why I want to introduce that is both the operational management objectives and learning material that we learned, and the learning material we're going to learn out of the strategic planning will help you in that final project. So chapter 4 has a case, and we're going to come back to this case a little bit later, but I'm just going to kind of introduce it. We have Ted Thompson, who graduated from pharmacy at the top of his class 2 years ago. Ted then went on to complete a pharmacy residency program, and he took a job as a clinical pharmacist at a community hospital. And this hospital has an opportunity to become part of an ACO, an account care organization. And if you remember learning about ACOs are financial healthcare networks designed to be able to utilize resources of various different healthcare entities in the area to take care of X number of lives. So, an ACO could include hospitals, it could include pharmacies, it could include AM care centers, um, different other types of disciplines like physical therapy. And so the hospital has an opportunity to become part of this. And the reason why they want to become part of it is if an ACO is developing in the area, they'll have access to those patients. And there's opportunities if they meet certain measure markers of financial reward. And because of these many opportunities in the next 5 years, the hospital is actually asking Ted to be part of their team to help develop a strategic plan. So, what is strategic planning? Most of us as pharmacists, when I gave the lecture on operational management, we all kind of can relate to that. And we can relate to that because, as nature, as pharmacists who specifically work in community pharmacy settings, hospital settings, AM care, long term care settings, where we are distributing product, we are very familiar with what organizational management is, that we have to be able to know the steps of beginning, to fill a prescription to the end, delivering it to that patient, whether it's through just a regular prescription vial or whether we are offering a service, if we're taking care of long-term care, personal care homes, we're putting it in special type of packaging and also making sure we deliver things like their medication administration records. But strategic planning is a little bit different. Strategic planning is us not in the heat of the action, but looking to where we need to go. And for those who want to move up into management, for those who would like to own their own business someday, you need to develop those skills of strategic planning. You need to, as one of my former mentors told me, is that leaders and managers have to not be always there in the trenches, but sometimes they have to be able to take that aerial 30,000 feet view of where we need to be going. So, in the definition by John Bryson, what strategic planning is the following. It's a disciplined effort to produce fundamental decisions and actions that shape and guide what an organization or an entity is, what it does, and why it does it. Strategic planning requires broad scale information gathering. So there's going to be research that's going to be not done to be able to explore before that final decision's made. This is where our company or this is where our new service is going. It needs to look at what are the alternatives, that if we did this, what would happen? And it needs to look at how is this going to impact us in the future, and so these future implications of our current present decisions. It can facilitate communication and participation. It can accommodate divergent interests and values and foster orderly decision making and successful implementation. All companies, for them to survive, cannot remain stagnant. We constantly have to be changing. In my prior life, when I was full time faculty, we would at least, you know, once every 5 years, come up with our next 5 year strategic plan. All companies do that. Myself, currently as a manager, we do a yearly plan of what are our accomplished goals we'd like to do, and then at the end of that year we reflect back to see where we got to those. And once you come up with that strategic plan, then you have to put the actions into place of how are we going to develop an operational plan to be able to do that. So they do go side and side. Developing steps in strategic planning occurs both at the beginning of a business and the future development of a business. It's an ongoing cycle, like I said. A good company cannot remain stagnant. If you think about some businesses that don't exist or are not as strong as they once were, is because they didn't allow for appropriate strategic planning, innovation. I always, in my entrepreneur class I teach at Duquesne, I talk about, I give an example of the BlackBerry. The BlackBerry was at its height was the top number one type of smartphone device. It had a nice keyboard. It had a good calendar system. It had, but it had a very rudimentary email system, and it didn't keep up and future plan what did consumers need in the software type. And then you saw, Apple come along and Android devices come along that pretty much just destroyed the BlackBerry business. So if you don't consistently keep moving, you're not going to be there. Another importance of strategic planning is either developing mission and vision statements or redeveloping. Or if you have a new initiative that is part of the major company, how does that new entity or that new service, what is its mission and vision, and how does it reflect upon the bigger mission and vision of that company? We need smart objectives and smart goals, because we need to be able to measure how, or develop how are we going to measure the success of our new strategic plan. We need to identify tools for reporting those outcomes to be able to do that. And for anybody who has been the head of a department in a business or the director of a department in the business, constantly you have to be reporting to upper management to show where you're going and how are you doing. Because if you don't show success and growth, what can happen? You could lose FTEs, your budget could get cut, your whole department could get cut. And so strategic planning not just happens at the higher level of a company, but should be happening also with great leaders within different departments. Or if you're your own owner of a business, you need to constantly be doing this. And so strategic planning helps facilitate the organizational alignment and success. Strategic planning could also help redefine what a business is or who they are. I'll go back to the tech industry. Look at Netflix. What was Netflix initially? It was a business that mailed you DVDs to rent and watch on your TV. But the company saw, as technology was growing, as internet was becoming faster, there was a better way to deliver this service. They reinvented themselves again when they realized they didn't own their own content, and it became costly to acquire older movies, or the only way they could get movies, because other premier networks had such a stronghold on it, they started developing their own content, and Netflix has grown to the business it is today. So sometimes businesses have to reinvent themselves. We see that in the restaurant business, we see that in the healthcare business. In the broadest sense, planning represents the purposeful efforts taken by a pharmacy organization to maximize, um, you know, its future success. Planning is one of the four key functions of a manager or owner of a pharmacy organization, along with organizing, leading, and controlling. Planning also involves more than just managers. Sometimes you need to have those frontline employees. You need to have input from the people that are on the boots on the ground who are operating, developing. A good leader and manager takes input from everybody. When I did a geriatric pharmacy residency back in the late 90s at Duke. And the very first day we were there, the head of the geriatric department was there. And there was numerous different healthcare disciplines that were doing either fellowships or residencies, included pharmacy, dentistry, physical therapy. There was also psychiatry, nursing, and Harvey Cohn, who was the head of our department, looked at us and said, "Myself, the physician, I'm only as good as the team that I have. That I need the vital input from every one of you when we see a patient." I take that same thought process when I look at it from a business. I am only as good when I get feedback, not just from my pharmacist, but my good technicians that are on the front lines, finding out what's working for them. Now, it still comes down to the point, as I talked about in the operational management lecture, that we need to engage our employees and have them understand what is our final intent of where we're going. But it's so important to include those frontline employees as well, because the importance of effective planning, many organizations invest significant time and resources in these efforts. And sometimes, too, you may need to bring in outside consultants to be able to do that. One of the things I know that I've experienced in both my current business and also when I was with Duquesne full time is we would bring in at our retreats outside facilitators to be able to get people to speak more, to kind of talk about missions. When we were getting into diabetes care at my current company, we actually had a focus panel where we brought an endocrinologist in, and we brought actually a type 1 diabetic adult in, and we listened to what their needs were, what their struggles were. So it helped us effectively plan what is our next services and how are we going to deliver those. There's many different types of planning, and the difference between the types of planning is the most important is what is their purpose. Well, strategic planning, which we're talking about today, is about achieving a long term vision and making sure the organization is doing the necessary things to ensure overall success to get to that long term um, vision. Business planning also is a type of planning that focuses on the feasibility of a specific program. So this semester, since we are a hybrid semester, the first project that you're going to have, and I'm going to talk about that today so you can start thinking about that, is the strategic planning of a new service. The second focus of this management course, which we do at the end of Focus 2 in the spring, is you are going to be doing a business plan. And I encourage you to help you. I know you have many things on your plate, is think about maybe what you develop for your strategic plan you're going to then build on for your business plan, because the business plan will then look at the financials, do marketing forecasting on the feasibility of your plan. You can do two separates if you want to. I won't discourage that, but just want to tell you the difference between strategic planning and business planning. Strategic planning is, looking at what we need to do, A business plan will help with the feasibility of that. And business planning, like all other types of planning, must occur within the context of strategic planning of an organization. So, strategic planning kind of goes hand in hand with business planning. So if you look, this comes from chapter 4, is here's the three types of main business plannings. We've got strategic planning, operational planning, and business planning. The purpose of a strategic plan, as I said, is to ensure the organization is doing the right things, to address what the business the organization is in or ought to be in, provides a framework for more detailed planning and day-to-day decisions. This is for the long-term vision, the 5-year plan, the 10-year plan, and it includes all aspects of the organization. The viewpoint is external and how the organization interacts with, so in pharmacy, how does it interact with other parts of our healthcare system? Operational planning, which we talked in the prior lecture, is to ensure that the organization is prepared to perform the immediate tasks and objectives to meet the goals and strategies of the organization, to ensure the organization is doing things right. So it's the who, what, where's, and how's of how do we get there. This is short term. This is living out that strategic plan once it's in place. And it is developing the immediate actions needed for the day to day to accomplish the tasks and the goals of the strategic plan. The business planning is to determine the feasibility of specific businesses, programs, or services. And this is usually done. So we develop a 5-year strategic plan. We're going to look at what is the feasibility of this and how can we accomplish this. There's a couple other types of planning. There's resource planning. So, somebody's involved in looking at, the different types of resources. They may be looking at different, some people may be looking at, okay, we want to expand our business. What is some land we might want to buy down the road? One of the other things I've been part of a small independent wholesaler over the years. And before they even bought or built their new warehouse, they were resource planning of what land they would need to buy for this. There is organizational planning to ensure the organization is organized appropriately. And so this might be restructuring what the board of directors looks like, or what is the management system look like within the company. And there's contingency plans, all right, planning to occur if certain crises happen. Right now 2020 was a definition of contingency plans. And so all types of planning play major roles in a business. But there are 8 common steps in planning. And the steps in planning kind of fall, into play, whether it's a strategic plan, a business plan, or an operational plan. The first step is we define or orient the planning process to a singular purpose or a desired result. And that is knowing what is our endpoint. And that can be reflected in our vision and mission statements. The other thing is we need to assess the current situation to help figure out what we need to do to get where we want to go for that single purpose. We need to, in evaluating the success of our planning, establish goals and identify strategies to reach those goals. And goals are the long term, overall global thing. But for goals to be achieved, we need to establish objectives that support the progress to the goal. We need to also have good timelines and accountability of who's going to do what. And we need to put this down on paper so that we understand where we're going. And then, even though we have a place where we want to go, that's where the objectives, developing the tools to measure success, that we need to continue to monitor toward meeting those goals and objectives. So, strategic planning, the purpose is to ensure the organization, as I mentioned before, is doing the right things now, but also where should we be in the coming years if we want to still remain a vital company. Remember that quote I gave you by Troy Triggerstad, and I think it's a great quote to think about is those who provide value in healthcare will still be here 10 years from now. So when somebody's strategically planning, how are we going to get there from 10 years from now? You could even think about this in your own personal professional life is how where do I want to be in 5 years? You always get that classic question in an interview, all right? And of course everybody kind of gets taken back by it or has different answers. But have we developed what is our goal of where we want to get to personally in our professional development? And I think that's important because if you do your own professional reflection of where you strategically want to be, then you can see of where you're working. Does they strategically line up to your goals? Strategic planning itself, it helps determine the current direction and situation. In addition, it helps determine the long-term care goals for the organization. So, example, how do I transfer my pharmacy business from just a prescription business to a more clinical healthcare business? We, as an industry, have been trying to develop that. And with value based healthcare, as I talked to you, when we met live, and I mentioned this a little bit in the organizational lecture, is that you see, these pharmacy care networks being developed. You see certain states adopting provider status. You see ways that pharmacy, which is a great profession that can help contribute, especially to the outpatient um, community in healthcare, that we may need to redefine of what we do. We also, if you look at your current company that you're involved in, they realize that they are not just, they want to be a healthcare company that's part of multiple different facets, whether it's in the long-term care industry or whether it's in the total delivering of healthcare. And so their strategic plan, and their vision is kind of looking at an all catch-all type of approach. So if we think back to that case scenario of Ted, all right, is that Ted and the hospital are seeking to become part of an account care organization. And this joining this may change the paradigm for strategic planning and may have a result in very different decisions. Why? Well, account care organizations a lot of times have their own specific measures they want you to meet. And so we may need to change how we deliver certain type of services or how what other healthcare professionals we get involved in these services so that we can meet those things. The definition of strategic planning, another one is the process of selecting organizational goals to determine the policies and programs necessary. Um, and to achieve specific objectives en route to those goals. Also, how this will be implemented. So, one of the things too for a successful company to meet those goals, you always have to be studying the industry, learning the industry, moving beyond the walls of pharmacy, and what is happening in other healthcare entities is also a key way to help with strategic planning. So, research is the first one is if I'm doing a strategic plan, I need to think about who is my customer? Who is the person that I'm strategically planned for? Is it the patient? Is it a hospital? Is it a physician? Is it healthcare insurances? Who is my customer identification when I'm planning this? And it could be multiple customers. Then in my strategic plan, what is my mission and my vision? Another important thing that should be part of any strategical operational plan or business plan is doing a SWOT analysis. And I'm sure you've learned this already, but it is taking a strong reflection of what are our strengths, what are our weaknesses, our opportunities, and threats. And when we look at our weaknesses and threats, we need to think about how can our strengths and opportunities overcome those? What are we going to need to do to be able to be successful, to not allow those to affect our strategic plan or business plan or what we're trying to develop. We need to then prioritize the issues. So when somebody's strategically planning, they may say, you know what, these are all great things we could do. All these things would be great. But what is the primary one we really need to focus on? In one of my prior lives, I dabbled into research, and it was more in practice research. And when you're developing a research project, there's so many different things you would like to accomplish, or so many different things you would like to evaluate or to study. But then, if you have way too many things, you lose focus. And I've taken those principles that I've learned from that from a business standpoint. Where so many things we could do, but we need to prioritize what is the main things that going to have a lasting impact. What are the main things that we can be successful at now, or we can definitely plan to be successful in the 5 years. And once we prioritize those, we then develop our goals and strategize our objectives to get to that. And the most final thing is you don't show success unless you can measure it, unless also too the players that you have involved in it, your staff, your other colleagues, is can we identify accountability? So success of strategic planning. Companies that engage in long range strategic planning are often more successful than those that do not. And I talked about this earlier. If you sit in a bubble and say everything's fine, we'll be fine, we just got to wait this, you know, no company is going to be fine if they're waiting for others to help save them. You have to be able to be proactive versus reactive. There are times we have to do reactive strategic planning. It's not ideal. In 2020, we had to live in a world of reactive strategic planning. And trust me, in the spring, we were meeting, we were doing meetings Saturdays and Sundays, just waiting to see how we are going to, act in the coming week based upon what new restrictions were coming down, what new guidelines were coming down. And, it's hard to do in that way, but sometimes you have to. Proactive strategic planning always is the best route. It enables an organization to control its environment instead of vice versa. And so not only that you're always going to be doing a little bit of reactive strategic planning. You've got a whole department that got called off sick. You've had a major, robotic entity, that helps deliver your prescriptions call off sick. You've lost a major account. So reactive planning is always still going to be part of a reality of it, but proactive planning is going to be a key one. Organizations that are able to think and plan in a provocative, and I hate this cliche, but out of the box manner, but basically thinking, where we need to be. All right. The great Wayne Gretzky of hockey said, you never skate to where the puck is, you skate to where you believe it's going to be. And so businesses have to be that are successful keep that mindset. And if you're able to be proactive, you can position yourselves to be control of your environment to create or recreate, all right, of that. And so, like I said, what are some examples of this? you know what types of pharmacy businesses or pharmacy services do you want? One of the ways is I told you about independent pharmacy, and I can speak for I speak for what I know. I don't always teach what I don't. I don't like teaching what I don't know, but I can speak from what I know. Is the companies that I've been involved with over the years, and I've been involved in community. I've been in institutional consulting. Is that they've been successful by able to reinvent themselves. What are the niches that can make them unique? The other thing is they also have to think about how does my current pharmacy business models make money? A lot of our businesses still make money by filling prescriptions, but there are other things that we can do. We can offer services that might be in weight loss management, diabetes education. We may get into smoke and cessation. We may get into MTM types of services. immunization. There's other opportunities that might allow to bring in other revenue. And I think the pharmacies of tomorrow and today, to get to tomorrow, need to be thinking about that we are not going to be able to sustain ourselves as a profession if we keep just relying on distribution of product. We have to, establish ourselves of who we are, the drug experts. And so for these futuristic pharmacy businesses, to be able to make money and to meet these strategic goals, we have to do strategic planning. And so, one of the things that I will be asking you in the reflective exercise for strategic planning is start thinking to yourself, where do you see the pharmacy business that you are involved in, or maybe the pharmacy business you want to be involved in, or the service in the next 5 years? And for your assignment, I will re say this in my overview of the assignment, is that you can pick something totally different that's totally new of what you currently do today. There are organizational factors influence pharmacy and practice and change. And so we have to think about what are the current laws that are happening? What are current laws are being happening that has to be changed? So what opportunities exist for the future of a pharmacy type of business? What are some of the barriers to those future types of businesses, which can be maybe laws or recognizing as different type of providers? What is some initiatives to develop the new revolution of pharmacy businesses? And so, the one thing that I've had the pleasure over the years, in where I work in, is that there are some great innovative pharmacists all across this country, and I've gotten to know as either friends or colleagues, and they're pushing the envelope of looking at that. This doesn't have to be that traditional pharmacy model. We don't have to be stuck in that. And but we have to plan to be able to get there. I have a colleague who's in North Carolina, and she has a pharmacy that's right next to a physician's practice, and her pharmacists participate in that doctor's office several days a week, and that doctor is actually billing for their services, and they have contracts of getting paid for those services. I have a pharmacy that I know that does long-term care, well, mainly personal care, where they're actually working with doctors' offices, and they're going out and doing pharmacy services right in the patient's homes. Or since COVID, they're doing telehealth, and they're able to, by contracting with these physicians, able out to bill out for their services and get paid for that. So you need to think about what are those opportunities. If you're looking into starting your own business, or you are looking to start a new service in the current business that you're part of, you need to think about, as I said, is one of the beginning parts of planning, customer identification. What do they want? Sometimes customers may not realize what they want or what they need. I always use the analogy is that, we're 10 years into, the smartphones we know of today, whether it's an iPhone or an Android. But, you go back 15 years ago, the trend of the industry was to make a phone as small as possible that it could fold and fit into your pocket. Now we got phones the size of iPads that people are carrying around. Did people think that they needed that initially? No, but somebody had a vision that that's what they wanted. A lot of times that's going to happen with patient care. I can tell you from the early days when I was doing immunization, when I first gave my first shot and somebody said, "Hey, how long have you been a nurse?" Now, as the last 2 weeks, I've gotten phone calls after phone calls looking for us when we are having our COVID vaccines, which actually I'm excited to say I'm going to be giving my first ones this coming week. Is that they are looking to us for the pharmacy because we've developed of that's what the customers want. And sometimes too, whatever service you're going to start or plan, you got to use the old geriatric pharmacy slogan. When we look at geriatric taking care of elderly patients, is you if you're recommending a dose of something, start low and go slow. The same with a new business entity. Another way to learn of strategic planning is to study businesses that may have struggled and looking at businesses that have succeeded. We're going to talk more in the second focus of this course about business planning, but business planning, as I said, also will help support strategic planning. And business planning is taking the strategic planning, which can be part of that business description, service description, and then looking at how would we market it, how would we financially plan for it, and how would we operate it. And so basically, what you would do after a strategic plan, you would construct a business plan. You would think about what resources might we need to make this strategic plan successful. What is some maybe startup funding we need to? And if I was developing my own business based on a strategic plan, what would be my legality of the business entity that I would want? And we would have to take into all those factors of what would be needed for the strategic plan, such as would we need additional licensing? Would we need another location where we may have to do lease negotiations? Would we need to become accredited? Would we need to have a remodel of where we want to put this business if it's a brick and mortar type of business? Are there different type of contracts we'd have to get involved to do that? So we have to think of that. Currently, right now, I'll use the COVID situation where we knew that we wanted to be able to deliver these vaccines, but this was not just like ordering flu vaccines, and so there was several steps where we had to retrain and fill out forms with both the CDC and our Department of Health. We also had to go through training on storage and transferring of these vaccines because they're very sensitive. We then had to look at, even though we are getting these vaccines for free, there are opportunities for us to bill for these from an administration point. We also know that there's different phases that people are qualified for these vaccines. And so we now have to come up with a way to stratify, to identify who gets the shots where. And then we needed to develop a communication plan to be able to get this out to public or to healthcare operators to need to do that. And so there are some costs that came along with that. We had to buy some new software. We had to look at, even though we were going to be giving some supplies, we had to look at our manpower of how we're going to do this. We had to look at locations because we couldn't do this traditionally in the pharmacy. So a lot of the things that you do in strategic planning is also part of business planning. So I share with this because I know that, every year when I teach, some people are interested in ownership, some people are interested in traditional management, but I share with this pharmacy ownership example. And so, like, if I was strategically planning to develop a business to own my own pharmacy and then come up with a business plan, I would have to look up startup costs. And so, if I was doing a traditional business, I had to think about, what pharmacy and software might I need? What is my beginning inventory? What is my fixtures that I might need? What is some signage, building costs, working up capital? So you would have to think of your startup costs. Even in a strategic plan is more a global vision, and then the business plan brings in the financial entities. For the strategic plan assignment you're going to have, you're not going to need to do that. But I just wanted to start to introduce the business plan part, which I'll give more of when we go into that. The other thing too is in a business plan versus a strategic plan, you would have realistic timeframes to evaluate the success. If I was starting up a business, when do I break even? If I was starting a new service, when do I break even? What is a realistic time frame to pay off if I had to get some funding? How am I going to compare the success of mine? And so those, if you have any more interest in that, please let me know, and I will talk more about business ownership or starting up a business. And it doesn't have to be a traditional community pharmacy, but I always open that up every year when I meet with people in this course. So I just want to give you a little snippet of that. So let's get back to planning. There was a study from 1996 that less than 31% of all pharmacy owners or pharmacy managers reported using strategic planning. And this came from the Journal of the American Pharmacy Association. Another study in 2005 reported only 26.8% of independent pharmacy owners use a strategic planning. And probably those who aren't here still today, they didn't do that. And as I mentioned before, the great Wayne Gretzky, hockey players always said, skate to where the puck is going to be, not where it has been. So let's look at the chain industry in terms of planning. Walgreens. For over a century, Walgreens grew by adapting its corner drugstore format to changing consumer needs and expanding to more locations. But with more than 75 Americans already living within 5 miles of a Walgreens, the company needed an additional path for growth. Insight collaborated with the largest pharmacy chain on his journey to transform the drugstore into his first choice definition for health and daily living. Upon taking the helm as Walgreens CEO in 2009, Gregory Wasson started formulating the new mission. And this is what their mission was. Our goal is to create an experience unmatched in this industry by focusing on well. He said this strategy was expressed most simply with a new tagline at the corner of happy and healthy. And I'm sure you've heard that in the commercials for Walgreens. And how did he do it? He first hired Insight Corporation to help with the strategic planning. He wanted to disrupt the care model. He wanted to chart the healthcare services roadmap. He wanted to reinvent the role of the pharmacist, and he wanted to focus on improving outcomes through prescription adherence. Some of these we've already talked about. And so those were his strategic plans of how to get there. So Walgreens has been able to measure the effectiveness of this new strategy innovation by looking at the high number of patient consultations with pharmacists that they track in their business, customer satisfaction surveys, looking at how many new patients they've acquired, and looking at a higher retail market share, now nearly 20% nationally. Under Project Roadmap, Walgreens is now has moved into some of the tougher areas of chronic care, such as hypertension, diabetes, high cholesterol, and asthma, that collectively amount for 85% of total U.S. healthcare spending. Another thing that Walgreens, I want to add here, did was they were in a lot of different contract disputes because they saw that the reimbursements were bad. And there was a point where they were kicked out of Express Scripts completely, especially on the really mainly on the commercial realm. And so Walgreens did was their strategic plan also focused on being the ideal place for Medicare patients. And they do, if you look at their marketing, do strongly put that there. So strategic planning is happening every day. If you notice lately too, and I want to bring this up when we do our live discussion, is Rite Aid, and I'll give you something. I'll give you a little update or give you something to read that we can discuss when we meet live. But Rite Aid right now is reinventing themselves, and if you haven't seen that, take a look at that. But I'll save that till when we meet live. So, as I said, there are steps in the planning process, and we define or orient what we want to do. That's where we develop our mission and vision. We look at the current situation. We develop goals. We develop strategies to meet those goals, and we develop objectives that will support the progress to those goals. We then define responsibilities and timelines. We write out a communication plan, and we monitor that progress. And so here we are back at that planning phase. And so the first thing is the pre-planning phase. What is it and what do they need? And this is where you may need to do some research. In our organizational talk, I gave you two readings for your assignment, and that they were on med synchronization. And if you think about med synchronization, that came out of a program of not what somebody needed or thought they needed, but it was something that the pharmacies felt that this is something we think that patients would like. And if patients like to get all their meds filled at the same time, we've been doing this actually, think about MedSync. Long-term care, personal care pharmacies have been doing this for 30, 35 years, or even maybe longer. And the community industry said, hey, this is a good idea. Plus, this also gets us to a point where that we can get oops, sorry, let me go back here. We can get patients to be more adherent, and if they're more adherent, this will help us with a lot of our um, contracts that have pay for performance tied to them. So this was an identification need of a service to develop, and then we had to then come up with the mission and vision of it. We had to look at the SWOT analysis of it, and we had to prioritize goals of how we were going to get there, and then we had to define the metrics of the success of that. And so internally in our company right now, we measure the successes of our, MedSync program with two things. We look at how many people have signed up for the month, how many people are still signed up, and we look at the growth factors. We also have a long-term strategic plan goal of our MedSync program that if we can get, our goal is right now we're at about 40% of all our patients med synced of our chronic med patients. We actually are, our ultimate goal is to get to 80. And that seems like a pretty lofty goal. But think of the reason why we want to get to this goal. If we can plan our days versus people walking into the store plan our days, we can free our pharmacists up to do more other type of healthcare entities, which then have a big impact on workflow, which I did talk about in that workflow lecture that I had you watch. So let's go back to our case scenario. Ted Thompson graduated from pharmacy school magna cum laude 2 years ago with a doctor of pharmacy degree and successfully passed the licensing examination, making him a registered pharmacist. After graduation, Ted completed a pharmacy practice residency in AM Care. Following his residency, Ted took a job as the pharmacist in the local small community pharmacy chain, looking to expand clinical services as part of the community pharmacies initiative. In hiring Ted, the Community Pharmacy Corporation was filling interim objectives to the goal of developing contemporary pharmacy services. The pharmacies are located in a region of approximately 100,000 people, and a large portion of that population is elderly. In working with the local hospital, the pharmacy chain has explored in getting involved with 340B and transition of care program. All right. And both the pharmacy chain and the hospital has done very well from a clinical economic perspective with 340B. The community pharmacy has in recent years focused on star ratings, incorporated a MedSync program, and adding immunization services. Now, both the hospital and the pharmacy chain are in talks to be part of an account care organization, a network of hospital for providers that deliver care and assume risk for achieving improvements in the quality care and reductions. Because of the many opportunities that confront the pharmacy chain, they decided they should develop a plan to guide its priorities over the next 5 years. To accomplish this, the president of the pharmacy chain has determined that over the next several months, they will undergo a strategic planning effort. This effort will begin with a selected group of individuals from within the company, each representing key functions and constituencies. Ted asked was be part of this group because of his clinical role and expertise and his affiliation also with the pharmacies. And because expansion of clinical pharmacy services provided by the department is recognized as a goal. Ted recognized the need to learn more about the purpose of strategic planning and the process that will be required to develop that goal. So think about this, all right? Ted is part of the this community pharmacy corporation that's part of the hospital. The hospital already has looked at a couple things. So 340B, if you're not familiar, and I can talk about that when we meet live, 340B is government contracts that hospitals can become a 340B provider in underserved areas. And basically, what happens is they can purchase drugs a lot cheaper than what our community pharmacy does. The community pharmacy doesn't make money by filling the prescriptions the traditional way. They get a management fee. So the pharmacy can make some money by getting a management fee of handling delivering the prescriptions to the hospital. The hospital makes money because they are getting the higher reimbursements because they're purchasing the drugs cheaper. And by doing that, they then have to use that revenue to help fund other programs. Transition of care program is another program the hospitals are interested because hospitals get penalized if they if patients get readmitted in less than 30 days. Traditionally, patients like congestive heart failure patients, COPD patients, AFib patients, pneumonia patients. If they had a pharmacy that could make sure that the discharge meds are filled, maybe they're delivered, maybe they're specialized packaged, maybe they're then put on a MedSync program, it would be less likely that these patients would get readmitted. One of the things my pharmacy does, we do a transition of care program with our local hospital. We actually call patients 48 hours after they get discharged and get the meds to make sure if there's any questions. So there's numerous opportunities that the pharmacy could be getting additional revenue from the management perspective and from the transition of care. The hospitals purpose of this whole program is that by being the pharmacy that offers the med sync and the immunization, Those are two quality measures that are required by ACOs besides the discharge, the readmission thing. And so the hospital may get additional revenue. So could be a win-win for both entities. So strategic planning is so important. So we've already, in this case scenario, identified the needs of customers. And the customers are not just the patient, it's the pharmacy to the hospital and the hospital to the pharmacy. Now we have to identify strategies of what are the goals of this, all right? And from those goals should be reflective of what is the mission and vision for this strategic plan. Then, under those goals, we should have the objectives that are going to help us achieve that goal. And then we need to come up with the multiple action plan tasks that have to occur for us to meet that objective, that meet that goal. And so this is constant cycle in developing a strategic plan. So an annual strategic, plan also should be able to look at, should be demonstrated by thorough planning, a consistent and systematic approach. And the strategic plan also has to give you the who, whys, and wheres too of this is why we see this vision. This is our goals for it. This is what we hope to by measuring that we get out of it so that we get a buy-in by key stakeholders, which could be board of directors, the CEO, the CFO to be able to do that. The annual strategic, plan should also look at accountability for pharmacy leadership and staff. We should have successful objective measures. Whatever new program we're looking to do, it should be aligned with the mission and vision. And if it isn't, maybe we need to rewrite the mission and vision, or maybe it's not something for us. And we need to strategize with priorities. We also need to look at specific goals and strategies and how they align with the company. So, as I said, the first step is that pre-planning, that customer identification. So you start doing brainstorming, to identify customers, and those customers can be internal and external, just like that example with Ted. You use to identify all those who are affected by the actions and outcomes of the pharmacy team, and you use to identify what do customers want or need, and also think who is our customer. And so before we even, you know, get get out of that first step, we need to make sure we feel solid that this service is going to serve those people and these are our customers. Then either we need to look back at our current mission and vision statement or develop a new mission vision statement, which may be just for that service, but that mission and vision then also may be part of the higher mission and vision. And that mission feeds the confidence of your organization. And the vision creates the momentum, anticipation about the future. Now, when I was younger and I learned about mission and vision, I kind of poo pooed, oh, that's just nice. It's a nice little slogan or whatever. But I can tell you, if you have a good mission and vision and everybody buys into it and you say the verbiage every day, it becomes a way of life. It is what you do. And by doing that, you can get others fired up. This is what I do. So that mission statement should be the purpose of why we're here. Our business, our values, that is our mission. It's the opportunities or needs we exist to address. What we do to address these, and the principles and beliefs that guide our work. So to build a compelling mission statement, it should be inspiring, support, and commitment. It should motivate. It should be convincing but easy to grasp from a mindset. It should have proactive verbs to describe what we do. It should be free of jargon and be short enough to be easy to repeat. How to write an effective mission statement. The mission is the purpose of the company. The mission statement defines what the company does or is. And there's a nice little link here from an article from the business magazine Fast Company about writing a mission statement. And I will have you have access to that. So, for example, here's a mission statement of a pizza organization. Our mission is to serve the tastiest damn pizza in and around. Our mission is to present with integrity the highest quality entertainment solutions to families. Here's Google's mission statement. Google's mission is to organize the world, information, and make it universally accessible and useful. Think about what Google does. Do they meet the mission of what they say they're going to do? The vision is, what does success look like? It should also motivate us, inspire us, but paint a picture and stretch the boundaries of what a company looks like. Here's Amazon's vision. Our vision is to be the Earth's most customer centric company, to build a place where people can come to find and discover anything they may want to buy online. What is your company's vision statement? The vision is what the pharmacy organization wants to be at some time, future time. CVS, we strive to improve the quality of human life. Rite Aid, customer confidentiality chooses us first for their everyday health and wellness needs because we consistently understand and exceed their expectations. St. Joseph Hospital, the core values that guide us are reverence, integrity, compassion, and excellence. And this is my family's pharmacy. At Patent Pharmacy, we do not want just to do our best, we want to be the best at what we do. Sorry. The next step is the SWOT analysis. A couple years ago, I was at a pharmacy business meeting in Florida, and we had actually Magic Johnson, former NBA player, speak to us. And Magic Johnson, after his career, actually became a businessman. He helped put Starbucks into urban, underserved areas. He helped, develop some movie chains in urban areas, and he eventually helped become one of the buying partners of the Los Angeles Dodgers. And when I was listening to Magic speak, he had a great reflection on himself, and he talked a lot about sports and how he strived to be successful in sports. But he said that not only does his companies do SWOT analysis, but he does his own every 6 month SWOT analysis of himself. And he does this because he wants to evaluate where his weaknesses are, where his threats, and reevaluate where are his strengths and opportunities. And so when we're doing a strategic plan, we got to look at what are we good at, but what aren't we good at, or what might make this whole thing not to be successful. Once we do our SWOT analysis, we need to prioritize our issues. What needs to be done first? Sometimes I know when I've been in strategic planning meetings, we've actually had breakouts where we've had, whiteboards or easels with paper, and we start having everybody, rank what they think are prioritized and come to a consensus. And then when we come to that consensus of what are those priority issues, we then have to think about what is the goal of that issue and what are the strategies and objectives to meet that goal. And so those all should occur within that planning process. For developing objectives for your goals, they should be SMART objective. They should be specific, state exactly what is to be achieved. They should be measurable, capable of measurement, and can determine if it's achieved. They should be achievable, realistic, giving the circumstances in which it is set and the resources available to the business. And they should be relevant to the people responsible for achieving them. And there should be timeframes set and deadlines to make them realistic. So let's look at, is this a SMART objective? Improve the environment in the pharmacy. No, it doesn't meet those criteria that I said. Decrease the cost of wasted drugs by 25%. There is a measurable objective. Improve patient care by implementing emergency department pharmacists. Measure of success to exceed 2,000 clinical interventions in 9 months. That is a good SMART objective. Relocate the central pharmacy to a larger space. That is not, that's just an idea. Increase pharmacist clinical competence. Measure success is attendance at 4 classes. decrease variations in process. That's pretty much, generic. But if we say that it's going to standardize 80% of the pharmacy policy procedures within the system, there is an objective. Implement a system-wide sterile compounding training program and achieve 90% rate for all participants. There's a smart objective. Standardized delivery routes for all technicians. Measure success as a 97% compliance rate on monthly audits. There's a smart objectives. Pharmacy will be actively involved in an ACO in 5 years. That is a goal, but it is not an object, but it has a time. We do not want the beauty pageant objective. My goal is to achieve world peace. We want to be able to find metrics and assign accountability. And you want to be able to, how are you going to get those measures? Through, is there reporting within your system? Are you going to have to develop new, data collecting tools? Can we do this on a software plan? So we need to be able to do that. Once you come up with all that, then you commit your plan to writing. You make it detailed, you outline it, you share it with other members of the department, you share it with those who are in leadership, and define how do we look at this plan. So, as I said, the strategy that this is an example of a strategic plan. The department will align its pharmacy services to be consistent with the hospital's initiatives to become part of an account care organization. The goal is we're going to develop and implement specific clinical pharmacy services that help deliver care, improve patient outcomes, reduce spending, and or generate revenue. Our objectives: identify gaps in care delivery, quality, and spending where pharmacy services can lead to improvements. Select one clinical pharmacy service to implement in the short term. Here's the tasks and objectives that are tied to those. We're going to perform a situation analysis of the hospital's account care organization in the pharmacy department, including a SWOT analysis. We are going to prepare a list of clinical pharmacy services that can be developed and implemented to meet the needs of the organization and compare the services on the basis of feasibility and impact. And we're going to select the most appropriate service and develop a business plan for that service. And then finally, there's the execution phase. And so we will then develop teams, we'll educate those teams on our strategic plan, we'll gather baseline data, we'll refine metrics if needed, we'll develop action plans and timelines, and then you just go out and do it. Once you start implementing this, then you have to have the monitoring phase. Who reports at least quarterly from team leaders? Take action as needed to adjust based on those reportings. Dashboards or scorecards for visual reporting, routine presentations. You may need to also keep people up to date of what's happening with either bulletin boards, newsletters, meetings. The reporting should at least have quarterly reports from each accountable person. Maybe create dashboards or scoreboards for visual reporting. We have in our Flip the Pharmacy initiative, we have a dashboard, washboard in each store, which looks at how many patients are synced, how many immunizations we did this month, how many e-care plans we did this month. And so we're doing a dashboard on some of our services. Provide routine reports, presentations to keep people, having regular meetings when needed. And as I said, bulletin boards and staff. So here's an example of a pharmacy dashboard. They're tracking the drug expenses, comparing it to budget. They're tracking the FTEs of it compared to budget. They're tracking overtime. They're looking at interventions. They're looking at turnaround time. And so this is an example of specific measures and comparing them to their goals of where they want to be. And this is an example of looking at out of stocking in the dispensing unit of, a more detailed report. But you have the dashboard and then you have the more detailed report. Stephen Covey, who wrote The 7 Habits of Highly Effective People, has with habit 2, begin with the end in mind. It means to begin each day, task, or project with a clear vision of your desired direction and destination, then continue by flexing your proactive muscles to make this happen. One of the best ways to incorporate habit 2 in life successfully for your own professional achievement is to develop your own personal mission statement. If it focuses on what you want to be and do, it's your plan for success. It reaffirms who you are, put your goals in focus, and moves your ideas into the real world. Your mission statement makes you a leader of your own life. What are some barriers and limitations to planning? Well, Failure to commit sufficient time to the planning effort. So there need to be scheduled meetings and need to hold people accountable in this planning. There's also sometimes interpersonal issues that, trying to get everybody to consensus. That is why sometimes when we've done large strategic planning in different organizations I've been part of, we've brought in outside moderators to help us with this. Maybe you have a lack of planning skills. What does your current planning skills are? There's lots of maybe different self-help books out there. There's always new ways we can learn to become a better planner. Failure to plan far enough into the future. The downside of pharmacy is a lot of times we do have a constantly changing environment, but that should not stop us from doing strategic planning. Failure to implement owning to the lack of time or lack of resources. Failure to monitor progress, the lack of support of top executives, board directors. So you need to have buy-in from the company. This is something we want to do. Barriers to effective planning, as I said, you got to get the time to be able to do that. That's what retreats are for. That's what maybe a day where we shut off our phones and we're just going to do that. We're going to work with others of that. Before we bring an idea to the table, we may need to do a consensus survey of where do people think we're going. As I said, there are a lot of self-help books to help with lack of planning skills and failure to plan far enough. And we've already talked about those. So, questions to consider. Think of a specific community pharmacy practice. What barriers do you believe would limit the ability of the pharmacists and the pharmacy managers to conduct effective planning in that setting? What changes have occurred in the practice of pharmacy over the past 20 years? And how would strategic planning have enabled a pharmacy organization to better position itself for those changes? So think about things that have happened and how could we have been better at that? How many pharmacies, probably when the PharmD came into existence, did they sit down and say, okay, we're going to have a new degree of pharmacists come work for us? What can we do with that? And that new curriculum they have. Most companies didn't do that, and that is why we're still lagging behind in being able to do clinical services in a pharmacy. What future changes does community pharmacy have to strategically plan for in the future? And I'm going to go over your assignment, but these are some questions you're going to ponder in your assignment. You're going to list some of those changes. How do we find about them? And a SWOT analysis on those. I leave you with these last two slides of you also want to develop your own way do I learn about things. Traditionally, when we work in a pharmacy, we have our drug information resources to keep us up to date on our drugs, what's happening with drug therapy. And that is important too, because sometimes our strategic planning might be focusing on a disease state, but we also should be up to date of what's happening in the industry. Now, I have a Twitter account. I don't tweet. All right. So if anybody wanted to follow me, I'd be rather boring. But what I did over the years, I created lists and I follow pharmacy organizations. I follow different healthcare entities outside of pharmacy. And I at least once or twice a week review those lists, and I have different types of software that has helped me do and pull the articles from those lists. And I pull those articles because I want to look at where is the industry going, what new is happening. Once a year the PQE, the Pharmacy Quality Alliance, meets to look at the star ratings and if there's anybody new measures. I follow and track any healthcare policies that are happening both the state and federal level, and those allow you to stay up to date and start building your knowledge of where should pharmacy be going, either for the company you work for, or maybe you're looking to move somewhere else into the industry or move up, or for your own personal professional. And I think it's very important to figure out, as a professional, as a manager, as a leader, how do I stay up to date of what's happening in the industry, not just pharmacy but all healthcare. And so I'm going to go over in a separate video your assignment, but your assignment is that part of it is you are going to do your own reflective of your own personal mission statement and what future niche for community pharmacy, and outline the steps to make that part of a business. I thank you very much for your time for this lecture, and please look at the short two videos outlining the other part. Take care.